Hello, Kathy Forzley, are you there?
Yep, I'm here.
Hi, this
Hi,
is Kelly Bennett. I'm the
hi,
Chamber's
Kelly.
Marketing and Event Manager. Welcome.
Thank you. I got your email yesterday. Thanks for sending that.
Yeah, we appreciate your support and for joining us today. So you're just phoning in, correct?
Yeah, I am.
Okay. Are you okay with us recording this conversation and sharing it with our members on our website and through
Yeah,
social media?
absolutely.
Okay, perfect. Thank you. So you're my first person to arrive, so.
This is a new computer I'm on, so I just wanted to make sure it was working okay. It does not have a camera.
Oh, okay. Yeah, my laptop doesn't have one either, so I have to use my iPad.
Yeah, usually I'm at work, but today I'm at home, so.
Yeah, we've been working from home, obviously since the governor's stay-at-home order.
Right.
So it's been an interesting and overall, I think, a good experience for me. So
Yeah, we learned a lot, right?
yeah, I think so.
We don't always have to meet in person.
No, I mean, yeah, it's interesting, but we're doing so many events virtually. And
Sometimes I think we get better participation even.
yeah, that's what Joe, our president, was saying about our board meetings.
Yeah.
So, yeah, I would like to see some more attendance on our webinars. But we did one with a nationally known speaker and had almost 100 people on one.
Wow.
So our attendance range on our webinars has gone from about 12 to 100. So
Wow.
yeah,
That's great.
it is. It's exciting. I mean, it's a strange time, and I guess we're all learning and being challenged to grow. So
Exactly.
yeah.
Hi, Kelly.
Oh, Sam, are you on? Hello.
Hey.
So Sam is our marketing engagement manager. She's been with the chamber, just over a year?
Yeah, almost a year and a half.
Okay, so we also have on Kathy Forzley, the director, is it correct, Director of Health and Human Services for Oakland County?
Yep, that's correct.
Yeah, she's phoning in today, so.
Okay. Great. Well, thank you so much for joining us.
Absolutely.
How are you, Samantha?
I'm great. Just, hanging out with my nephews any chance I can get.
How long are they staying in town?
I'm not really sure. They're just gonna hang out here till whenever, till school starts. So, better to be, quarantined together than apart. So.
Yeah, that's
South
nice.
Carolina, they start school early, like first week of August, so they'll probably go back maybe end of July sometime. So.
I bet your parents are loving it.
Oh my gosh, they're in heaven. My dad, he's on a work trip right now. I'm not 100% sure where he is, but he's at some police station, maybe Kansas? I'm not sure.
Oh, really? That's
Yeah.
where my family all is, in Kansas, so.
Oh, really?
Mm-hmm. My mom's whole family.
The company he works for, they sell simulation software. So he works with police stations and military bases all over. So.
Wow.
Yep. So he trains them and.
How does he like traveling right now? It's got to be a unique experience.
He said, honestly, the airports have never been cleaner.
Yeah.
He's like, why couldn't they just have done this the whole time?
Yeah.
I mean, but before he gets on the plane, they hand him sanitation wipes like 20 times. And the whole planes just smell like cleaning chemicals. He's like, all right, I know this is clean when the whole plane smells like Clorox. So.
Yeah. Well, we should have more people logging on any minute now.
Yeah, I logged on a little bit early. I've been noticing that a lot of people don't log on to like the exact minute it's supposed to.
I see that too.
Yeah. No one wants to be like social.
That's right.
Talk before they have to. That's okay.
Right.
I know some people are probably like getting some Zoom fatigue, so.
Yeah.
Maybe just meet people where they're at. So my mom, she works for the Taubman Company in Bloomfield Hills, and they gave her this like really cool like welcome back gift, and they had like wipes and branded masks and all of these goodies. Oh, let me see that keychain. So then they gave her this keychain. Look at how cool this is. It's called a cootie key. And it's so you don't have to like touch the doors when you open them. So you like
Oh, wow.
with this, and then the butt like to like press keypads and elevators. And
How
stuff.
about
Oh, and
that?
like ATM pad. I mean, that's so cool.
It's cool, and then it just like goes on a little, I don't know, keychain thing. I was like, who invented that? That is genius. Oh, the guy that invented it's from Michigan, apparently.
That's cool.
But how are the kids, Kelly?
They're good. My daughter and her best friend slept in a tent in the backyard last night. So I didn't get the best night's sleep just because I was worried. I was worried all night.
How
But
fun
now
though.
they're making pancakes. So
I know I want to try and do that with my nephews while they're here.
yeah.
I know they'd like that. They definitely won't sleep in the tent the whole night, but we'll see how long they make it.
You know, the girls have tried this before, I think last summer, and they didn't make it all night. So I was kind of surprised they
Yeah.
were.
Just leave the door unlocked, wait for them to come
We
in.
did, yeah. There's Linda.
Hi, Linda.
Oh, here we go. People are starting to flood in.
It's like no one wants to join till it's like the moment it starts. Can't hear you, Linda.
I've already had a Zoom at 7:30, and then I drove from home here to be at the 10, and it's all good.
Oh.
Hey, Sam, were you able to catch up with that French lady?
I'll have to check my email. I had a couple of emails this morning that came through, so we'll see if she responds.
I sent you a couple of leads. The French
Yep.
lady wanted to get in. I saw him at the farmer's market in Farmington.
Oh my
And
gosh,
I-
no way.
Yeah, so he's excited.
Oh, I didn't. What was the last part? I didn't catch it. What you said.
No, he was excited. I said, he's moving on to Old Woodward, and I said, I sent your information to the membership manager at the
Yeah.
chamber. In his little French little, hey, you okay?
Yeah, I left him a message, so I'll have to check and see if he got back.
Good morning, Joe.
Good morning, Kelly. How are you?
Good, how are you?
I'm doing well. So, Kelly, I have a question for you.
Yes.
How are we rolling this out this morning?
I figured you could facilitate. We have Kathy Forzley. She's already in, but she's phoned in. There's no video, so it's just audio for her. And Dave Coulter hasn't joined yet, so.
Okay, so just give me the cue and I'll say something.
Yeah, sure. We can welcome everyone just after 10. We'll give, we have, I think, 25 people signed up. And right now we are at 7. So we'll give it, you know, we've got 4 minutes to 10. And we'll give it maybe, I don't know, 6 or 7 minutes to officially start. So.
I don't know what's going on with my background.
I know, I was gonna say it's like a little mix of wine and
There you go. That looks good.
much better.
How's that?
Very good.
That looks good.
All right.
I still have to, I've been meaning to make on Canva, Kelly. They have like a template now for Zoom backgrounds.
Oh,
And
do they really?
Yeah, and so every time I'm in there, I'm like, oh, I gotta remember to do that, and then I just keep forgetting. But I'm like, oh, I should make one with our logo or something that we can use.
That would be really cool.
But yeah, my uncle was showing me, he works for an advertising company, and he said that's something that they've been getting a lot of requests for, is like Zoom like branded Zoom backgrounds. I'm like, oh my gosh, that's so smart. But and then my
And it's-
dad, his
Yeah.
smart idea was someone should come up with an app that you can use to like change your Zoom clothes on your app, so you can switch from like casual to a suit. So if anyone on this Zoom call is good with technology, there you go. $1 million idea.
I kind of forgot about this session. I was just on my weekly MACP call, and I was getting ready to join the call very casually because it's audio only. And then I'm like, ooh, actually, I have a 10 o'clock with the county executive. I better put a collar on.
Yes, I did put a plaid blouse on this morning.
Good morning, Michael.
Golf shirts away.
I see Michael, but I can't hear him.
Let's see. And Cheryl joined too. Good morning, Cheryl. Not sure if you can hear me. And Dave Coulter just joined. So we've got both of our presenters on. So we can get started in just a couple minutes. Good morning, Mr. Coulter.
Good morning. How are you?
Good, thank
Morning,
you.
David.
Welcome.
Morning. Hey, how are you?
Finally, another person with my energy.
Indeed.
My husband always tells me, he's like, Sam, I overhear your Zoom calls and you just sound like you've had so much coffee.
That's because you're like, people.
I know, right? Yes. I miss people.
Yeah.
Ew. Well, I'm glad we're on the same energy level.
Me too. Me too.
Morning, Dave. It's Kathy.
Oh, hi, Kathy. There you are. I was going to say, where is that? There's Kathy. Kathy's not able to join us by video today, but we'll have her golden voice.
Absolutely.
So it's just now 10 o'clock. We're going to wait a few more minutes to admit the rest of our participants as they arrive, and then we'll get started with our discussion. So we have people joining as we speak. So.
And Joe, I can now say hi, so we're all good.
Oh, hi,
Oh,
Michael. You
Good
made it.
morning.
Yeah, but what I was going to say, whenever I do a video call, I always start it with everybody's camera off because I don't want to surprise anybody. So.
Do you know, we actually set that on auto on all of ours. So each participant who joins has to turn on their own audio and video for that reason.
Right.
That's the default for us.
Some of my favorite Zoom calls have been with my Rotary Club in Birmingham, because a lot of our members are a little older and they may not be as technology savvy as some others. And some of the things you see going on in the background when their cameras are on are quite hysterical. You know, I think they forget that, you know, it's an open camera. So you'll see somebody making a sandwich or, you know. It's been
As long as that's all you see.
It's a
You know,
learning
you do-
experience for all of us.
You also see their spouses walking by behind them, like one was in their robe and they said, honey, I'm on a Zoom. And it's like, okay.
Oh, that's funny.
Yeah.
It's Chris Winnens.
Well, hi, and Linda, again, this is our second meeting already today.
Hi, honey. I know. Ours is at 7:34.
Hey, Joe, how are you?
I'm well. How are you, Chris?
I love your background. That's very cool.
Thank you.
Oh, and hi, Cheryl. Oh, look, friends from all over. There you go. Except Cheryl's kind of frozen there.
She went with a professional headshot.
She's going to be on mute, I think, for this call. She has a new grandbaby and is helping out her family with
No, I need details.
Sorry.
Should have muted myself, sorry.
no worries.
Always texting.
There's Ellen.
Okay, we're still expecting about five. Oh, here we go. We're expecting about 5 more people, and I've just had 3 hop on. So, why don't we go ahead and get started? My name is Kelly Bennett. I'm the marketing and event manager for the Birmingham Bloomfield Chamber. And also joining us today on our staff is Samantha Michalak. She's our membership engagement manager, and Cheryl Gerald's our operations manager. And and our president, Joe Bowman, who I'm going to turn things over to in just a minute. We'd like to thank our county executive, Dave Coulter, and Kathy Forzley, the director of Health and Human Services for Oakland County, for joining us today to give us an update on what they're working on at the county level and how they see things moving forward. So Joe, I'd like to turn it over to you.
Thank you, Kelly. Good morning, everyone. Good morning to Dave and to Kathy. Thank you so much for joining us this morning. This is part of what we're calling our Teletown Hall series, where the Chamber wants to make sure that our business leaders stay connected to their elected officials. I know, Dave, especially yourself, have been very active on social media, providing updates for what the county's doing in terms of operations. But we were hoping to really focus maybe a little bit this morning more on what specific things are you doing to support the small businesses in Oakland County.
Yeah.
Having said that, I will say, personally, I've been very impressed with the leadership role that Oakland County has taken. I was fortunate enough to participate on one of the grant committees for your Oakland County Small Business Stabilization Fund.
Yeah, and thank you for doing that, by the way. Yes.
So I saw firsthand the impact that we made for hundreds of small businesses in Oakland County with the cash infusion that they really needed. And then last week, I also participated in distributing some of the PPE toolkits that the county made available to small businesses. We handed out about 300 over a 2-day period, first in downtown Birmingham, and then our offices at Adams Square. So again, the gratitude that was expressed by our small business members and friends was great. So really 2 great initiatives. So I'm hoping maybe you can explain a little bit about how that came about and where the funding came from, and then what the county has planned going forward. And then when you're done with that, we'll hear from Kathy, and she can talk about the impact of COVID on the county from a health standpoint. So David, why don't we start with you?
All right, that's great. And Joe, thanks. It's great to be back before your group. And I'm proud to be with my partner in crime, Kathy Forzley. We're kind of the Coulter Forzley show these days. We do a lot of town halls and presentations to help people understand just exactly what's going on in our county related to COVID, both from a public health standpoint, which she is obviously the expert on, and from an economic recovery standpoint, which I know is of interest to this group. So, and I've said from the beginning that, or nearly from the beginning, that we really are fighting a battle on 2 fronts, right? There's clearly the public health efforts that we have to wage and we have to take seriously in order to mitigate the spread of the virus and to bring the numbers down. And the great news, as Kathy will explain to you in a bit, we have brought the numbers down in Oakland County. And there's no question in my mind, and I think when the folks look at the data, they will see that the efforts that we made and the cooperation of our residents and our business owners, even though it was incredibly difficult and financially painful, I don't think there's any question that those efforts helped to bring those numbers down. And as Kathy will, I'm sure, touch on, one of the things that we continue to keep our eye on is a possible second wave, right? And so as we reopen our economy and as we get businesses back up and running, we have to be mindful of a second wave. And so that doesn't mean that we stop and that we continue to do nothing until all waves are over. I don't think any of us believe that or think that we can afford to do that. But it does mean that we have to be prepared. And so, what I've said is that the reopening needs to be done, but it needs to be done carefully and it needs to be done safely. And that's what we're trying to do in Oakland County. And yes, that was certainly the intent of the toolkits. The toolkits and the grants are so far the two largest things that we've done with our small businesses, and I'll just talk a little bit about both of them. But both of them have been meant under the philosophy that we have had and that I have had, that Oakland County, although we have to enforce the governor's orders and we even have some additional health orders of our own, these things aren't meant to be punitive. And we don't see our role as primarily the enforcer. It's really, our role, we feel like, is to help our small businesses and our residents navigate these rules. We want to be a help, not just a punitive enforcer. I've said from the beginning, I didn't want to fill up the jails with people who didn't practice social distancing in the appropriate ways and all of those things. So we've really tried to be helpful and lean in. And so we did an immediate infusion. Joe, as you mentioned, you participated in that process of $14 million in grants, not loans, but grants to our small businesses. And we knew early on that was going to be a huge issue, that there were, most small businesses don't own their properties, so they have rent that's due and utilities and some payroll expenses and just all the expenses that come with normal business operations at a time when their revenues have stopped. So I was really pleased that we were able to get those $14 million out the door. And as Joe alluded to, we set up sort of zones around the county, and we asked our business partners, members of DDAs and chambers of commerce and other community leaders, to help us make the decisions around those grants, because your communities and your business partners better than we do, frankly, although we have a pretty good relationship with our business community. And so I think that was very successful in helping to mitigate that initial panic that this could literally send my business out under in the next couple of months. And so I think those went a long way. Now, as we've begun to reopen the economy, we got the same kind of questions and anxiety about, what does that look like? How do I do this right? What are the orders? How do I make sure that I'm practicing, the social distancing that I need to in my business? Where do I get the supplies and that kind of thing? So what I was really excited about with the small business reopening kits, which I think Birmingham was the very first community to get them, because your chamber was so proactive and drove up and picked them up, frankly, because they literally came in those big cartons that you see, and we made 10,000 of them. So we had a warehouse just full of these. And the reason they were that big is because we made sure that we didn't just put the rules, again, we didn't just put the orders in there, but we tried to make it as easy as possible to navigate those rules. So we had $400 worth of PPE supplies in there, from sanitizer to masks to gloves and the like. We had a poster that sort of explained to your customers what was going on. We had stickers that you could put on the floor to help navigate what 6 feet might look like, and all the rest. And again, trying to make that as easy as possible. Every business is different, right? Every location is different and unique. And we've tried to trust our business partners to help navigate these rules in their own unique spaces. And so that was a huge part of what we tried to do. And I believe those 10,000 kits are pretty well all distributed now. I keep waiting for them to ask for another order of them, because they went like hotcakes, as my grandmother used to say, and they proved to be quite popular, and was really glad to be able to do that. So now we're seeing even more businesses reopen, and I knew that that initial $14 million in grants was going to be a lifesaver in that first phase, but we are really entering the second phase now, and I recognize that additional support is going to be necessary. Now, Joe, you mentioned where did this support come from? The good news is that Oakland County on these efforts does not have to dip into its own budget, which we didn't prepare for this kind of an expense and we didn't budget for. But we were fortunate in that we were one of the governmental entities that received CARES funding that was authorized back in January. So if you were a governmental unit larger than 500,000 people, you were eligible for CARES. That number is important because now, you know, we're hearing and seeing in the paper about another effort to do what they're calling the HEROES Act. And this would make all cities and villages and townships and counties eligible regardless of population. And there's a big fight in Washington whether that's going to happen or not. It's not clear that it will. But we were fortunate that in the first round, we qualified based on our size, and we received more than $200 million to fight COVID. And it was hugely helpful. And so we've used our CARES dollars to fund that small business grant program and the toolkits. We also designated another $10 million for our nonprofit organizations. I don't know if you have any nonprofits in your chamber. I'm guessing you must have a few. And they were incredibly hard hit as well. And their revenue sort of dried up. I talked to so many nonprofit leaders who said, you know, we had our big spring gala that we couldn't do, or, oops, I don't know what I did there. Or, you know, our fundraising, you know, people are financially challenged right now, and our fundraising has really dried up, but their actual work has increased as they protect the most vulnerable people in our population. So we set aside another $10 million for our nonprofit community as well, again, coming out of the CARES. And then the other thing we did to our local communities, because we don't know if they'll end up getting any federal support or not, is we designated another $30 million so that we could help reimburse our local communities for the COVID-related expenses that they've had. So they're very pleased about that. We don't know if they'll get federal funds, but we're going to support them with county dollars for their COVID efforts as well. But it's very timely that we're having this conversation, because later today, I'm having a press conference at 1:30 where I'm going to announce the details of the next round of funding for our local businesses. And we're really targeting in this round of funding our restaurants, our retailers, and our personal service businesses. These are ones that have been incredibly hard hit by the pandemic and continue to be challenged even as they reopen. And a subset of that, by the way, will be support for our minority-owned businesses who have additional issues of access to capital and these sort of things than even other businesses. So this afternoon, and I can't give you all the details now because I'm going to unveil it at 1:30, but I want you to know that at 1:30 we're going to announce. I'm looking to see what we're calling it, because we always come up with these cool names for these things. And we're going to call it the Oakland Together Economic Recovery Grants, and it's going to be $30 million. So, Joe, obviously, we will make sure that you and the chamber staff all have the details of this. We'll be rolling this out. It technically has to be approved by our Board of Commissioners, but I've been working with our Board of Commissioners, and we knew, you know, early on that we would need another round of funding, because, you know, those funds got our businesses through this first initial phase, but folks are still really reeling from this. And the other thing we know is, you know, 93% of the businesses in Oakland County are quote unquote small businesses, 50 employees or less. They are the lifeblood of our economy in Oakland County, and Oakland County is the lifeblood of the Michigan economy. So we've been laser focused on helping to make sure that these kinds of businesses get the support they need. So later today, we'll be announcing, as I said, another $30 million in grant funding to support our local businesses. So happy to share all the details with you when we get to that point. But maybe before, you know, I imagine there's folks that have questions, but maybe before we do that, Joe, would it be appropriate to just sort of let Kathy talk about where we are in terms of the virus itself and how that influences what we're doing?
Sure, absolutely. Before we do that, and we do want to leave time for questions, because I'm sure those on the call will want to ask questions, but I just want to let you know, David, as it relates to your nonprofit fund and then the new fund that you're going to be announcing. So our chamber in Birmingham Bloomfield, we have something that we call our nonprofit network. We actually have more than 50 nonprofits and 501c3 organizations that are members of our chamber. So we're right with you, knowing that they have need. And frankly, the chamber's largest fundraiser of the year is our village fair, which is our annual carnival. We partner with our nonprofits in that, and we allow them to receive grants from that. Well, unfortunately, we had to cancel it this year.
Yep.
Typically give out about $20,000 in direct support. So I'm glad that the county's filling that void. And then lastly, you know, obviously Birmingham, Bloomfield, we have large areas, downtowns. We have probably, again, about 50 restaurants that are members of our chamber. So whatever role we can play in supporting your new initiative that you're going to announce this afternoon, we want to be front and center to help our members.
Thank you. You've been a great partner already, and I appreciate that. Yeah, our nonprofits, we just can't overlook them. And as you pointed out, their biggest fundraisers are not happening, but their work hasn't stopped. And they provide just an incredible resource in our community. And by the way, they hire people. You know, they employ people in our community as well. So they're valuable partners as well in everything that we do. And by the way, if you don't know this already, if you have questions or your nonprofits have questions, we partnered with the United Way to help us process those grants and evaluate them and get them out the door quickly, because it's what they do, evaluating nonprofits. So if any nonprofit wants to have more information about those grants, they can go to our website, but that's just going to take you to the United Way website, where there'll be a Oakland COVID button on there that you'll see and get more information about those grants.
Terrific. So now if we could, we'll turn our attention to Kathy Forzley, who's the Director of Health and Human Services for Oakland County. Welcome, Kathy.
Good morning. Thank you. Pleasure to be here this morning. I'm going to jump right in and talk about our testing initiatives. We have been really focused on testing in Oakland County, and we have, in the last couple of months, conducted more than 82,000 tests in the county. And from that testing, we have determined there to be over 8,500 cases. Unfortunately, over 1,000 deaths. But the good news is that a number that is climbing steadily in the recoveries is more than 7,200 that have recovered so far. We have been doing a number of drive-through testing opportunities. We work Mondays and Wednesdays in Southfield at our Southfield offices, and Tuesdays and Thursdays in our Pontiac location, and Fridays are in Novi. And to date, and we've only been doing that, I guess, for just maybe over a month, maybe 6 weeks. We've done 8,700 tests through the drive-through. But very good news that out of 8,700 tests, only 274 positives. That's still a number we'd like to see come down, but that's approximately a 3.14% positivity rate. If you look at our dashboard, excuse me, that's something to keep your eye on, because we're continually watching that to see the case counts come down every day. And so you might want to check that out from time to time at ogov.com/COVID, go to the dashboard. But we look at that closely, and we're very encouraged by the fact that May 31st was the last date we had more than 20 new cases in a day, many of those days being in the single digits. And it's been since May 18th when we last had more than 50 cases in a day. So we also have a 7-day average where you can see the daily or the weekly averages, they just keep coming down. So that's really good news for us. Another place we're really focused on is senior living facilities, which anything from nursing homes and rehab centers to independent living facilities, of which in your area, there's several large facilities that have participated in comprehensive testing. We're very fortunate to have our paramedic partners, our fire departments partnering with us to help us with this testing initiative. And I'm happy to say that Birmingham Fire was one of the first to come on board and volunteer to be a testing partner. So they have helped us in these facilities. To date, we've done 35 facilities where we've completed comprehensive testing, which comes to close to 5,000 tests that were delivered at these facilities for their residents and their staff and their medical providers. And out of those, we have summarized 26 of those. And that means our epidemiologists have really looked at the results, did the contact tracing for any ones that have come up positive, and that looking at 3,013 results, we only had 58 positives. And most of those are from the early days of our testing in those facilities. And I have to tell you that probably about the last dozen facilities we've had, we've only had 0, 1, or 2 positives. So this is really good news in moving them toward back to normal so that they can get back to business as usual and integrate those residents back in the community again, which I know they're anxious to do. We've also worked in.
Kathy,
Sorry?
I'm sorry. But before you continue, I just want to clarify something.
Yep.
So I believe Oakland County is offering testing on demand, correct? You don't have to have a doctor's prescription. You don't
Exactly.
have to.
Yep.
And are you offering both the COVID test and the antibody test?
So let's start with testing on demand. So that's in our drive-throughs, and you don't need a script. There's no charge. And the only thing you do need to do, though, is call a day ahead at least to make an appointment, because we want to get all of your information done up front so you can just zip through that drive-through. I mean, you're literally there for 5 minutes, sometimes less. No lines or anything like that. And that phone number would be our nurse on call, which is 800-848-5533. And they will take your get your appointment set up and you're ready to go. So this is for the swab test, the molecular test.
And by the way, you don't need symptoms. That's a key distinction.
Oh, yes.
Because I know in some places you still do, but not in Oakland County. So
Right.
you don't have symptoms to get the test.
Thank you, Dave.
Yeah.
You're right. So this is for the swab test, and it's important to note that we are not offering the antibody test. The swab test is the one that tells you if you have active disease. The antibody test, there's a lot of, there's a lot of studies that need to be completed before people have the confidence in this test. There are a few antibody tests going on in the community that are associated with very large clinical trials, and they actually take blood from your arm in a vial, and it's part of a study, and these we believe are quite reliable. But some of the rapid antibody tests have not to date shown the performance that they should, and actually most of them are not FDA approved. They just need a lot more study to take place before we can rely on them. So if you can get yourselves to, if you're interested in an antibody test, those that are offering the clinical trials would be a good place to align yourself. And if you want more information about that, once again, you can call our nurse on call. And if they don't have the immediate answers for you, they will seek them out and call you back. So no to antibody tests right now, although I am hopeful that in the future, we will be in a place where we have the confidence in them that we're actually providing them along with our molecular test. Dave was saying we have orders in place. We really only have one order left in place, and that's around childcare. And actually, we probably will be either rescinding it or changing it because the governor's orders really do cover that. I also wanted to mention a couple of newer executive orders from the governor that are particularly important for your sectors, and that is Governor's Orders number 110 and 114 really gets to the Michigan's workforce. And she also in 110 talks about gatherings and businesses. So those are two very important orders. Honestly, they change rapidly, so we all have to keep our eyes on it. And if you, again, have any questions about the governor's orders, if you want to call me or even start with Nurse on Call, we can get you answers and help you with some of this. It's a kind of a confusing landscape because they change pretty rapidly and you have to really keep your eye on them. Our best tools for reopening and what we're really working on are social distancing, face covering, testing, and case tracing. Armed with all of these tools, we're really confident that we can move forward into reopening phase. And, you know, we keep talking about the potential for a second wave, but quite frankly, with these tools, and now we have more PPE than we did a few months ago, we're in a good place not to see a big spike as long as everyone is doing their best efforts to comply with the social distancing requirements and face coverings. As we open up, everyone's very enthusiastic about getting back out there and congregating. And, you know, we're seeing a lot of people that are kind of throwing some of these tools out because I think COVID's over. It's really important that we all stay engaged in that way because that's the best thing we can do to keep our businesses open, which we all want to do. We need to work on that. We want to be able to open schools in the fall and get people back to work, but it's going to be these tools that help us get there and stay there without having to do what we look around the country and we see other states already closing some things down again because they weren't able to keep a handle on that when they started to reopen. So we want to be your partner in that regard. If there's anything we can do to help you work through some problems as you open up businesses. I know that having spoken to a few business owners, it's been difficult in terms of people walking into their stores without face coverings on. They're not wanting to create a scene in the store by asking someone to put it on who's belligerent. And then on the other hand, wanting to protect their employees and the other customers in the store who are really looking towards the business owner to protect them while they're there. So we understand this is a difficult landscape. We're happy to facilitate conversations around that and see what the best practices are and learn from each other as we go. It's so important that we stay connected through the opening phase so that we can lean on one another and we can bring to you the best practices we're seeing around the country in that regard. So, and then one thing I didn't talk about is case tracing a little bit. We have really geared up for this. This is one of the things that will make this second wave, should there be one, different from the first wave in that we have a lot of staff trained, ready to go, and every single case that's identified, our nurses, our epidemiologists, and others and our staff respond to each and every one, make sure they're every case is quarantined, and really walk through with them where they've been, who they've been in close contact with, close being the key word, and then follow up with those close contacts. And we stay connected to them for 14 days through the incubation period and make sure they're not having any signs or symptoms, really reassuring them, educating them. And then if they do show any signs or symptoms, really getting them the help they need right away. So I think that's it. And I'll turn it back over to Dave.
Great job, partner, as always. You know what, a couple quick points I want to make, and then Joe, maybe we could take questions. But one of the things that I neglected to mention is we got really good at becoming a supply chain for equipment, PPE, and the like, some of which is very difficult to get. And our primary customer, if you will, in the first spike was the healthcare system in the hospitals because they were just woefully short. But we've gotten much better at getting it. and the hospitals have as well. And so we're not going to disband our efforts in that area, but what we decided was that we can help our local businesses and nonprofits and community partners to secure this equipment as well. So Joe and your staff in particular, just know that our Emergency Operations Center, although it might be acting a little differently today, will continue to be a resource for you to find PPE. So I wanted to remind you that that resource is available to you. And then the last thing I would say is, I talked about why we didn't want this to be punitive. And I just want to sort of make this point. We know that getting our economy back on track is not about simply reopening businesses. We also have to restore or maintain consumer confidence, right? I mean, 80% of the American economy is consumer driven. So we can reopen, but if consumers don't feel safe and they don't, going into the different locations, it's not going to work. And so I just, again, want to thank our business community because I think they've understood this. I haven't been beaten up by business people telling me, let me open, let me open, let me open. What they said is, help me understand how I can re-engage my business in a safe way that keeps my employees and my customers safe. And that's been the goal, so that we can reopen this economy. It might be a little more gradual than just doing it in a rush, but just as Kathy said, I think that some of the places that have done it too quickly are now having to shut back down again. So if we do this carefully, we can avoid that and we can get back on our economic feet. So I just wanted to make that point as well. So Joe, your show.
Yeah, one of the things that we're struggling with, and I think business operators are struggling with, is the whole issue of requiring face covering. Everybody has a sign on their door, but not everybody's doing it. And I know it's starting to cause some conflict. We've been trying to be consistent in our messaging of, social distance, have a face covering, but I fear that this is going to become a bigger issue before it gets smaller. And I don't know if, and I don't, frankly, we're kind of at a loss as to what we can do, because as you mentioned, these businesses are grateful for any customer who's walking through their door right now.
Of course.
But they're trying to follow the rules. So it's an ongoing
yeah.
We got a lot to see on the way out.
A lot of animals on the way out. We'll see. Well,
Joe, I absolutely appreciate and respect that, and I get it. I hear about it a lot. I hear about it from business owners who don't want to play the heavy. I hear about it from customers who go into a business and they don't see people wearing masks when they are, and so they're upset that these businesses aren't taking it more seriously. I guess the only thing I can respond to that is this. One of the other reasons we've tried to do this to build cooperation and confidence as opposed to a law enforcement perspective is we simply don't have enough cops to arrest everybody who doesn't wear a face mask. And we're not trying to turn business owners into the police, right? That's not fair. It's not their role. And so what I would say is a couple of things. What I tell people that are uncomfortable going into a business where these things don't seem to be happening is that you should not make a scene, not scream and shout and be antagonistic. You should probably seek out the manager, explain that you don't feel comfortable in that store or location, and let them know that you're not going to shop there for now, but you'll come back when you feel safer. The managers and owners of those stores need to hear that. On the flip side, and the more difficult side, is if you're an owner or a manager of a business, making sure that you're doing everything possible to make it as convenient as for people. And so sometimes that requires having the masks there. Some people get irritated because they don't have a mask on them and they don't want to go home. So making it clear that that is expected, that there is a mask. And then unfortunately you have to just unfortunately make a judgment of whether you're going to continue to serve that customer minus a mask. Kathy would tell you shouldn't do that. But I guess, and I don't disagree, but I'm saying I'm not asking them to be police officers either. And so it's a judgment call, and that's why we've got to do this together. We have to be in this together. And so this division and this people that do it as a political statement, I totally don't get that, because this is just us protecting each other. And so we're going to have those hard conversations. And like I said, we're not going to throw a business owner in jail because they couldn't keep their customers from wearing masks. But we just have to keep trying to do the right thing and explaining what that right thing is, and do the best we can. And I know that's not a perfect answer, Joe, but that's literally where we're at right now.
Yes.
You know, I agree with that. Just one more thing I wanted to add is the fact that when I first started in this business, I used to inspect restaurants like decades ago. And when I first started, it was difficult for restaurant owners to get people from not going in without shoes on and without shirts on. And that was the big deal then. It's like, and then they developed, you know, no shoes, no shirt, no service kind of thing. And now it's matter of fact, and that's never an issue anymore. So I keep hoping that, you know, this will settle down over time. And probably, I agree with Dave that, you know, we don't want this to become a police show, because that doesn't work. We don't want business owners to feel like they're becoming the police agency, because that's not going to work. It just draws more attention to it. So I think just the more matter of fact, you know, lead by example kind of thing, and go through it calmly. And, you know, I think in the long run, it might take care of itself eventually, just like shoes and shirts. I used to be so frustrated by that, you know, almost 30 years ago. And now, you know, nobody ever has that problem anymore. So
That's a great example. That's a great example, Kathy. I've grown up with that being the rule. So that's a perfect analogy, and it will take time for people to.
And same with smoking, you know, that when you weren't allowed to smoke in restaurants anymore. So
well, Kathy,
you know,
I hope
everything goes through a transition.
For everyone's sake, I hope you're right. So we have about 20 minutes left. We're going to open it to questions. What I would ask everyone to do is to have everybody stay on mute. And if you go to the bottom of your screen, you should see a little reactions tab. If you click on that, you can raise your hand, and that way we'll know you'll want to ask a question. And then Kelly will acknowledge you, and you can go ahead, unmute yourself, and then ask the question.
Samantha, did you have a question?
Yeah, well, on top of what Dave and Kathy were saying, something that I thought was really interesting, I'm out in South Lyon, and a store that's out here, something that they did to properly set expectations with their clients and their customers was they made sure that you could not miss their huge signs in front of their store that said, stop, with the huge hand and a stop sign, and it said you cannot enter the store without a mask. And then if you didn't have one, like if you forgot it in your car and you don't feel like walking back, they had a disposable one that you could use to shop in their store. Something that Joe and I frequently talk about is, you know, properly setting expectations with clients and customers, because, you know, making sure that there's a proper line of communication ensures that, you know, at the end of the day, both the business owner and the client or the customer is going to be happy. So I think just properly setting expectations with how you want to conduct business and how you want your clients to conduct business with you, I think will really help make sure that, you know, no one walks away unhappy. So I know there's a lot of chamber members right now that are providing signs like that you can put in the ground in front of your store or in your window. So I just thought that was a great idea. And I've actually been seeing a lot more stores now having those giant signs. So that way, before you come into the store, expectations are set. So just an idea.
Yeah, it's a good one.
Love it.
Thank you. Was it Renee Marino? Did you have a question? You can go ahead and unmute yourself.
Nope, I did not.
Okay, sorry. Does anyone else have a question then? No questions?
We did such a good job of explaining it all. I hope that's true. How many people on the call? How many people on the
we
call
have-
by a show of hands got a small business toolkit? Wave if you got one. I'm just curious. All right. Well, a lot of you aren't on video, but all right. All right.
Linda, do you have a question?
Yeah.
I just wanted to comment. I didn't get it. Thank you very much. And I just wanted to say, Dave and Kathy, fabulous job that you've done with Dave, everything the county has done. Kathy, you did mention once again that, businesses started too soon. Florida, near my in-laws, near St. Petersburg, some of my favorite bars and restaurants have closed because they opened up too soon. So you know what, we did the right thing. As much as people were complaining about it, we did the right thing. And as bad as my hair looks, Thursday, 5:30 on my salon, I told her, be prepared. I'm going to be there about 4 hours. She said, that's great. But you know what? It was well worth the wait. So I just wanted to commend you both on a great job and keeping us safe.
Thank you. Oh, by the way, I forgot to mention, but this is a very exciting day for me because I go to Six Salon, which many of you are probably familiar with. I don't know if they're a chamber member or not. I hope they are. But I'm getting my first haircut this afternoon in 3 months. I'm pretty darn excited about it.
I think Ann Duke might have had a question. She had her hand up.
Ann, I noticed you were on. How are you, dear?
Hi, everybody. I did not have a question. I was testing the wave, but I will say I'd like to thank the county on behalf of all of the nonprofits for the Oakland Together Fund that you've put together. As soon as I get off this call, I'm going to be finishing our application from Habitat for Humanity. So thank you. You are right. We took a hit like all businesses, but our clients that we serve need us now more than ever. So thank you to the chamber for putting this together, and thanks Dave and everybody at the county for the great support we've received thus far.
Thanks, Ann. Ann and I go back to our days working in the HIV/AIDS field together on the, so she's been a great nonprofit and for-profit leader for a long time. So great to see you this morning, Ann.
So, yesterday was a great day for our cause, huh?
Indeed it was. Indeed it was.
Yes.
So David, I'm assuming that you on a regular basis are in contact with our state elected officials as well as our representatives in Congress.
Yeah.
I would be remiss if I did not ask you for a favor on behalf of not only this Chamber of Commerce, but all of the chambers of commerce in Oakland County.
Sure.
A lot of people don't realize is that while chambers are not for profits and we operate very similarly to nonprofits, including the fact that we receive a majority of our funding from holding events and event sponsorship.
Yep.
Chambers of Commerce as a 501c6 organization are specifically excluded from any of the relief programs that the state of Michigan has done, the CARES Act funding, and frankly, even some of the Oakland County funds that have been done.
Yeah.
You may not be aware, but with the exception of 1 or 2 chambers of commerce in Oakland County, all of them are in serious financial condition. Most of them have either gone to reduced hours with their staff or have laid off their entire staffs, including some pretty close to your county complex. And what our concern is that in the next 12 to 18 months, local businesses are going to need their chambers of commerce more than ever to help them rebuild their business. But frankly, it's a very real possibility that many chambers of commerce may not be in business to help other businesses. So when you're talking especially to our elected officials in Washington with the HEROES Act that you mentioned, we've been working through the U.S. Chamber of Commerce to try to get 501c6 organizations included in that funding package. But you've got a lot of local chambers in your county that are really feeling the financial burden and they need help.
Well, I have some good news for you, Joe, because until about 2 weeks ago, I wasn't aware that a chamber fell into this odd 501c6 category. I had never heard of that term before, that acronym before. And it came up in terms of the programs that we were doing. So our next round of funding, and I don't want to misspeak. I'm not sure if it's this one I'm announcing today or if we've modified the 10 million nonprofit, but chambers are now eligible in Oakland County. We weren't aware of that, frankly, and when we were made aware of that, we've changed our criteria so that chambers are eligible because they absolutely ought to be eligible. And so now that I've learned that, I will certainly share that opinion and what we've done in Oakland County with others as well.
Thank you very much. Appreciated.
Yeah. Clapping from the chamber staff, I see. Love our chambers. Love our chambers. So.
Any other questions from anybody before we wrap things up here?
If not, Kathy or David, if you want to just make a final comment, and we'll send you on your way.
You know, I've talked enough. I guess I've said everything except that, you know, it's not a coincidence that we keep naming everything Oakland Together this, Oakland Together that. I've been talking about this since I first took over the job, that this has got to be a group effort and that everybody needs to be involved and nobody has all the answers and that we work better together. We work better when we work together. And so the chambers and our local small business community is just another example of how we need to be partners in this. And I think we're more successful when we are. So I want to thank all of you who have been doing the right things, as difficult as that has been. And I want to thank the chamber for all your support to your local businesses and your support to us at the county. It's how this works well. And so just, I want to thank everybody. Appreciate it.
And I was going to say something similar. We really need you to be our partners in this, and we're here to help. Please feel free to call the health division or myself anytime. If there's something we need to follow up with and talk through together, we're more than happy to do that. And we do that many times with a lot of different sectors that are going through difficult times. So please call on us and we will keep working for you.
Well, thanks
everybody.
To David and Kathy, thanks for everybody for joining. Have a great rest of the week.
Thanks. You as well. Stay safe.
You.
Awesome.